question about continuity of care for mental health care for our family members and our service members. So I am actually a licensed professional counselor, love my job, but every 2 years or so I move. And so on one end, I guess this kind of touches on our previous panel, in the past, before I did telehealth, I'd have to quit my job, move to a new state, get licensed in the new state, you know, work for a couple years, and then do it all over again. So moving to telehealth helped me as a spouse to maintain care as long as I'm in a state where I'm getting licensed, but I specialize in working trauma counseling with military and their families. So now I'm getting hit where my military members or their families are moving into a state where I'm not licensed. And so I guess one of my concerns is, especially when you're working on longer term mental health care and really trying to meet the needs of the family members at home or their children, are there any initiatives kind of in the works that will help that continuity of care? Because it is so disruptive, especially as we talk about the stress around a PCS season or a deployment. Now you're also losing your mental health care, and I see a lot of distress coming into the homes to our family members, and really the mental health component falling to the wayside due to those moves.
So I'd love to take that if you don't mind, at least initially. It's such an issue. It's an issue on both the continuity of care. It's also an issue on spouse employment, right? And we've talked about both of those things. As there are the interstate compacts, right? And the progress with the interstate compacts is, you know, the psychology compact, once it was enacted in, I believe, late 2020, 2021, it took off, right? It's easier to say what states are not part of the compact than what are. But we have a lot of work to do in social work. We have a lot of work to do in professional counselors. But that happens at the state level, right? Because every state has to enact or has to sign up to join that particular compact. There are also things that can happen at the state level to do exemptions, right? Or waivers or reciprocity. So if you want to kind of, you know, go down at the state level and really advocate for military families when your state legislation is in session, that's what I would recommend doing. I think a lot of people do that. And the military, I can't speak from total experience from this, but I know that they're very active in the process. I know that for Maryland, we have people from DOD who come every legislative session and say, we need this not only for continuity of care, but we also need this for spouse employment. And being able to actually transition with a family via telehealth through their move and help them continue to provide care until they get established in that local community, I mean, that is what all of our military families deserve.
Yeah, and I'll just add on to that. So there's a couple ways to address that. One is through establishing telehealth and maintaining telehealth. So it doesn't really matter when I PCS because the telehealth is consistent. We have 2 programs that do that primarily in the military health system. There's BRAVE for active duty service members, and Telemind. And so both of those are virtual systems. Obviously, patients need to meet criteria where virtual health is appropriate for their condition. But those are 2, and I know that the military health system is looking at how do they build out that capacity, because there are some issues as far as with overseas time zones, and also some, I don't know if it's more licensing, but country rules as far as where these systems are allowed to execute their missions. The second is what we would consider a warm handoff, is when somebody has particularly complicated care, it's recognized as an issue. And again, with 5 children, you can imagine that as we PCS, we have children with needs, and we, only am I the president of the company, but I also am a member in that way, and so get to use the system and really kick the tires a little bit. And so for folks who have more complex needs, it is that warm handoff design, that it would be the handoff from the losing unit and the gaining unit, and that the appointments could already be made with that new individual when they get there. That doesn't address the having to change providers, but that is sometimes necessary if somebody really needs that in person or their treatment is in person. So those are the two ways that they're looking to get after it. But I think this is a space, if you're looking for the silver linings from COVID, the amplification of telehealth, the acceptance of telehealth, and then the way that that can address some of our military unique issues has been really phenomenal, and just looking to continue to expand on that.